Last week, we took you on an ambulance ride to give you an idea of what to expect on the way to the hospital.
What were you doing when it started?
I was reading a book. I was Anna Karenina. I want people to think I'm sophisticated.
Now, my friend and CBS colleague Richard Schlesinger and I head into the emergency room to give you an inside look at a real-life hospital. Not one of those TV hospitals where, honestly, half the staff would be in jail for their antics. And Grey's Anatomy, I love you, but Izzy, come here. You cannot disconnect the heart support device of your lover in order for him to be able to get a transplanted heart elsewhere without ending up in jail. Real life may not be quite as exciting, but at least it's legal.
We have a high volume here of ambulance triage and walk-in triage. And when we stop here at our pre-triage desk, we will be greeted by one of our expert nurses.
Even the word triage is a little frightening. So what is it in layman's terms?
It means that you're sorting through a crowd who's very sick, who's okay to wait for an available doctor.
And how do you know that?
If you are an experienced ER nurse, you can actually make an assessment from a distance. The way they walk, the color of your skin, eyebrows, you can tell how sick they are.
Really? Just by looking?
Yes, just by looking.
From here, we do a further assessment, we do vital signs, then we further distribute the patient. We take a patient from here, put him in the appropriate area.
Would it be a good idea for people to just write down a list of what medications they're taking?
It's a great
I mean, just in case.
It's a great idea, and a lot of patients usually do that.
Up until just now, talking to you, it never occurred to me to do that. So that's not a bad idea.
Yeah.
So I'll do that today.
What happens here, we're going to ask the patient to get on the stretcher.
Yeah.
And we have a gown and slippers, and we take off your personal belongings. We put them in the bag for security.
If I were really a patient, how many people would be around me?
You'll have the nurse, we have the doctor at the bedside, you'll have the emergency room technician to get the EKG done. You may have another nurse to assist you depending on how many things you have on, or if you need help, if you're unstable. There may be a resident as well at the bedside.
If I'm here, again, as a patient with chest pains, you know, a little scared, probably very scared,
Of course.
and I'm hearing these weird noises and there are people rushing around me. Are you guys conscious of
How scared that
How
person
scared
is?
people
Of course
are?
we are. That's why we don't create the big ruckus and run over to you, because we know that you're scared. And the only way that we're going to be able to communicate also is in a very calm fashion, because we don't want you to be any more upset than you already are.
how do you keep track of everybody? How do you know, right? How do you know that somebody's not falling through the
Every
cracks?
patient, when they enter the emergency room, is assigned to a nurse, and that nurse has an emergency room technician to help them as well. We use our tracking system to see where the patients are because we have locations on that tracking system.
The reality is, I think, most times people aren't kept informed. I mean, I've been with family members and we've waited for hours and hours and nobody's said anything to us. That's a problem. I mean, if your guys
It is
are
a
giving out-
recognized problem, and this is why we're making sure that they interface with the patient and they try to keep them as informed in terms of what they are waiting for.
But there's a bigger problem that's countrywide, which is that there are almost 50 million uninsured people in the United States, and if they don't have a doctor, where do they end up?
In the
In the
emergency
emergency
Right.
department.
Yeah.
Some people don't realize that they may not really have a true emergency. It's just because they can't be seen by a physician or don't know where else to go.
When should you not come to the emergency room?
Well, if you have a minor complaint and you have a primary care provider, it's good to let your primary care provider aware. Let them know what's going on. Maybe they could take care of that in the private provider's office.
And if there's a question, of course,
You want to come, yes.
Many thanks to New York Presbyterian Columbia University Medical Center, where I'm on staff, for giving us truly unprecedented behind-the-scenes access. They've never before let cameras behind the scenes the way they did today, and I truly appreciate it. The staff here clearly understands how frightening it can be to roll into an emergency room. They also do whatever they can to prevent what's becoming a national problem, overcrowding and long waits, something that's tough to avoid, especially when almost 50 million uninsured Americans use the emergency room as their primary doctor. I hope today's segment gave you a sense of what to expect in an emergency room. And here's an idea. Get all your medical information together in one place. Your name, address, date of birth, emergency contacts, and names of physicians, including their phone numbers. Include your medications with dosages and how often you take them, allergies, a list of medical problems, insurance info, and anything else you think is important. We'll have this list on the website. It's best to carry this information with you, but as a backup, designate a health emergency buddy. Somebody you can trust to keep a copy of confidential medical information. Somebody who could readily transmit that information, securely if possible, to the hospital if needed. Until there's a national computerized medical record, it could be life-saving. Thanks for watching. Please send comments and suggestions to doc@cbs.com. I'm Dr. John LaPook. Good day and good health.